Welcome, everyone, to this episode of VetFolio Voice with a wonderful group of credentialed veterinary technicians about veterinary nurse empowerment and creating a culture conducive to learning and to everyone working at the top of their game. I'll keep my thoughts brief so I can tell you more about these ladies, but I'll give you one small hint as to what we discover in our talk, and that is that communication is key. All right, let me tell you about my guests. Samantha Sacasa earned her bachelor's degree in education from the University of South Florida in 2008 and her associate's degree in veterinary technology from Hillsborough Community College in 2013. Since becoming a certified veterinary technician, Sam has gained experience in emergency medicine, general practice, shelter medicine, and her personal favorite, wildlife conservation. She also taught as an adjunct instructor at her alma mater, Hillsborough Community College. Sam's professional interests include continuing education for veterinary professionals, fostering the human-animal bond, improving workplace wellness, and the Fear-Free Initiative. In general, she's passionate about improving the lives of animals and elevating veterinary medicine through education. I just love that. Such an amazing mission. Carolyn Spivock has been in the veterinary industry for over 20 years. She earned her bachelor's in animal and poultry science from Virginia Tech and her associate of applied science in veterinary technology from the Community College of Baltimore County. Over her career, she's held roles in patient care, leadership, hospital management, and field support and office positions. She's currently the Director of Technician and Assistant Development in VCA's Medical Operations Department. Carolyn's passion is helping to create opportunities for continued growth in skills, knowledge, and leadership development for our veterinary technicians and assistants with a special focus in team and patient safety. Brynn Hogan is a credentialed veterinary technician and VTS in anesthesia and analgesia. She has a bachelor's degree in anthropology and history from the University of Wisconsin. She started her career working in biomedical research and in 2010 became a credentialed technician. She earned her VTS in anesthesia and analgesia in 2014. Brynn has served on the boards of the Wisconsin Veterinary Technician Association, the Academy of Veterinary Technicians in Anesthesia and Analgesia, and the North American Veterinary Anesthesia Society. She's currently a Technician Instructional Design Program Manager for VCA in the Department of Knowledge and Learning. These ladies were great to talk to and full of so much insight. I love all of the knowledge that they collectively brought in from their individual careers. I hope you get as much out of this episode as I did. Well, welcome everybody. We're going to talk about technician empowerment and more specifically on how communication is related to technician empowerment. So guys, I'm just going to jump straight in with a question that I struggle with on a routine basis. Actually, that's not true. First, I'm going to say welcome and thank you for joining me. I'm so glad you all are here.
Thank you so much, Cassie. I'm happy to be here.
Yeah, we're excited.
Yeah, it's great to be here.
Thank you.
Yes, it's going to be a good discussion. I'm so happy you guys are all here. All right, now I'm going to jump in with a question that I struggle with. I find myself struggling with this on a daily basis. And it's how do I navigate asking a technician or nurse to take on a task or a case? How do I know whether I'm putting too much on their plate or allowing them to thrive in their job? I find myself walking this tightrope of not wanting to overload somebody and being concerned that if I ask them to take something on, that maybe I am asking too much and they're just not communicating that with me, versus not giving, technicians and nurses enough and them saying, well, hey, doc, why aren't you letting me do my job? So can you guys help me? Do you have any tips or tricks for how to walk that tightrope?
Yeah, I think one of the first things I would say is avoid the yes or no answer questions, right? Don't say, am I giving you too much? I think most technicians will say no. I think some that maybe are empowered will say yes, but maybe be more specific in the questions, in terms of, I've noticed maybe I'm giving you too much to do day to day. Let's sit down and talk about what's going on during the day. Am I giving you too much? What do you like to do? What do you not like to do? is there something that you'd like to do that you're not getting to do right now? Just opening up that conversation and not having it be a quick, can you take this on right now? Sure. And then you walk away, and then it just builds and builds, and there's no actual communication happening.
I think that's such a good point, Brynn, because that's the part, right? You have to do the work ahead of time before in the moment you're like, wait a minute, everybody's kind of looking really stressed. And have I now asked you to do something you're not trained to do, or you're not comfortable with, or you've got 5 other things? Have you gotten your break? Like all of that stuff. And I think that's such an important part, Dr. Cassie, is that the hospital environment is one of open communication, where if I'm like, I need a break for 2 seconds, that you're not going to get upset with me, and that we're going to be able to talk it through, and you're going to know, like I'm saying, I need a pause for a second, because we already have that relationship. And I think that's such a valuable aspect of what we have in our team dynamic, especially as we have new people join, to have those initial conversations, to be like, we're a team. I need to know where you're coming from, what you feel comfortable with, what you need training in. And if it's something where you're like, I've got a lot, let's have respectful conversation to say, let me see if someone else can help you because I'm in the middle of something.
I agree with that. I think that creating a respectful culture and environment is so important. And that when you are in those like stressful moments, when you're in the weeds, it'll be received so much better if it's already like known that this is a team effort. We're all here to do patient care and to do it well. And yeah, that you're creating a culture where everybody knows that they're on the same team, that they know that the doctor has their back, that you know that the technicians have your back, and that you can communicate your needs.
Yeah, so right on target here, communication. And I feel like all of you echoed the same sort of sentiment of put the work in ahead of time, sit down and talk to people ahead of time. And that makes a lot of sense because from my perspective, I feel like having that conversation ahead of time and letting people know, hey, if I'm putting too much on you, I need you to tell me that. I may not recognize it if I'm doing a million things. So I need you to tell me, and that's not going to be a problem, but I'm not going to know unless we communicate. And I think that is excellent advice of put the work, the communication, the talks in ahead of time to know where everybody stands before you end up in the weeds and everything going crazy.
And even as if you think about it, when you've started a new position or in a new job, wouldn't that be lovely for someone to be like, I want to hear what's going on with you. And if you're stressed out, or, you're not comfortable with something, I want to know about it, because that's who we are and that's what we do. And I think it's just a more welcoming environment versus get out there and get it done, I think that's probably been one of my favorite things about being a technician over 20 years is my relationships with my doctors and my team members, just that we can be super open with each other. And it just makes the day go so much better. And by the end of the day, you're not feeling super stressed because you've been able to speak your mind or take on tasks to be like, I'm not really sure how to do that, but can you help me with this? Because I want to be able to do that moving forward. I just think that open communication is key.
I love that, Carolyn. And I think it's so important to establish that culture beforehand.
Right.
It's easier than having to do it after the fact. Like, okay, we're having a ton of breakdowns in communication. Now we have to fix this. That can be really challenging. So yeah, I think that's important to be cognizant of.
Absolutely.
And when you bring new people in, if you have that established culture, they're going to see that, right? You're going to have that conversation. They're going to see that you're not just talking the talk, you're walking the walk. They're gonna notice that culture, and it's going to be easy to bring them in and solidify that is how it goes around here. We're open communication, and we actually listen to the answers when people express their thoughts.
Spoken like people in leadership positions. You guys can tell, how you got to where you are, that you've had to deal with a lot of these situations, in multiple different contexts. Let me flip the script on you just a little bit here, because I couldn't agree more with everything you said about open communication and being proactive in that approach. But there is an element, things do get busy, and sometimes we all do just kind of have to like put our helmets on and go in and make it through. And it's crazy, and we're stressed and we're busy, and we wish things would slow down a little bit, but sometimes they just don't. And hopefully that's not all the time, but we do end up in those situations. So one thing I have seen from time to time is, all right, we're doing this, we're communicating, things are open, we're making it through the day. And then all of a sudden, somebody who I used to
feel like was right there with me, even when things got crazy. Now, a lot of times when I'm asking, hey, can you help me with this? Can you take this on? I'm getting mostly no answers. Mostly, no, I'm too busy. No, I'm too stressed. No, I need to go over here. And I've ended up in like confusing places before where I'm like, I feel like I'm trying to be so conscientious of what I'm giving this person, but I'm still getting no back in a lot of these situations. And I'm starting to drown over here and feel like I'm on my own. Do you guys have any insight on a situation like that? Carolyn, I know that, like you said, you've been in the field for over 20 years. Have you seen that sort of thing happen?
Yes. And I've been part of it too, where there's just a lot of conflicting priorities and you're just not sure. And honestly, one of the things that I've seen work successfully is literally a timeout, just to be like, okay, guys, let's just stop for a minute. And even though time is so valuable and there's so many things going on, you can go ahead and level set with people, within 2 to 3 minutes and just be like, what exactly is happening? Like, did you just leave a really stressful case? Like, is there something else that's going on? Where are you at? And if if they rattle through and they're like, Dr. Cassie, I've got this, and this, be like, okay, so this is not the time for us, but what can we do to delegate out? Or, I haven't been able to take a break. I was supposed to leave 15 minutes ago. And sometimes just that time out to be like, okay, guys, let's get on a good playing field. Let's kind of figure, because sometimes when you're in the middle of it, it's hard just to see, okay, I don't know where to go. And then it'd be like, okay, Brynn, what do I need to do first? Like, help me out with this. And then we can kind of figure out things, because if I'm telling you no, probably I'm really comfortable with you. And I'm like, okay, she'll accept that fact, because just even what you're saying, like having concern for your team that you're overloading them or something like that. Not everybody is situationally aware in the moment. And so you might be the easy one for me just to say, right now, I just have to, I can't. But doing those timeouts, doing those huddles, figuring out like what's going on at the front desk. Do we have an upset client that we're dealing with? I just think those thoughtful pauses give each other grace to go like, wow, I seriously just need to go eat something. And we never not want people to take their breaks, right? Like that's very important for our mental mindset, how we do patient care. But sometimes when you get wrapped up in the moment, you focus on the patient and forget about yourself. And you're like, have you even like taken a breath today? And so then a lot of that stuff can seem super overwhelming. So that's just something in my experience. I've literally, people have done like the tea time out, like, let's just wait and have a conversation. And I feel like that's something, if you've established that culture, you've done the pre-work, it's pretty successful.
I love that, Carolyn. I love the way that you phrase that. A lot of times, if a technician was reliable and you're noticing that lately they're not, that can be a sign of burnout. So, like, when was the last time that technician took a vacation? Or are they constantly missing their lunch breaks and leaving late? Like, what is causing this additional frustration? And it is a very frustrating situation, right? Dr. Cassie, you have patients that you need to take care of. You might have 2 or 3 at the same time, and you're like, I don't have time to do all of this. I need support. So in those moments, I understand that it's really frustrating, but I think that we handle those moments the best we can. And then you kind of look at it from an overview of, okay, what is causing this?
Yeah, that's a great point. Both of you have said stuff that really resonated when I think someone just keeps saying no, that's a sign of something else. And it's usually a sign of either that person needs to stop and like take a breath, stop and reassess, or there's something underlying that needs to come out. If you just keep saying no, there's something else there.
So exactly kind of what we've focused on in this podcast is communication and open communication. And I think you guys touched on a lot of really important points. Sam, you mentioned handling what you can in the moment. Like you can't make everything, if there's a bunch of cases and you don't have the help you need, and it seems like things are going crazy, then just focusing on what you can do one thing at a time, and it'll all get done. It'll all be okay. It might take longer than we want to and be a little more chaotic, but we'll get there. And then circling back around to figure out what caused it in the first place. So taking that focus on communication, any specific areas of communication that help you guys in particular? Can you think of an example maybe of a doctor or a team member who communicated with you well and you're like, hey, this works great. Can you do this more in the future?
I really think, and I know we keep saying communication, but I really feel like communication is the key to empowerment, right? So if you can advocate for yourself, you certainly can advocate for your patient, because usually we advocate for our patient first more than ourselves. And I think that in the relationships I've had within the clinic, or just kind of in the industry, in general, is being okay to ask, being open to be like, I'm not challenging why, even from a doctor's perspective. One of the gifts I think technicians have is their critical thinking skills. And you don't get that necessarily just from a book, right? Like you get that from being in with patients and learning from the other people around you. And so I think that mentoring approach, or being open, maybe not in front of a client, being like, why did you do that? Being thoughtful with your words, but, just being like, okay, can I listen to that? You identified a murmur. I want to put my ears on and I want to listen to that too. And being like, where exactly, how would this implicate, or impact this patient? What kind of nursing care do I need to look at differently because this little one has a heart issue? Like, where do we need to minimize stress? What do we need to watch out for? And I think that open communication, not only just that I'm able to express my concerns, but that I'm able to learn from you and you're completely good with that. I think some of the doctors and even technicians that I've had in my career have challenged me, be like, okay, well, why did I make that decision? And you're like, what? I don't know, you did it. But you learned something, and or ask you to do a math calculation on the fly. And it's not meant to intimidate or embarrass, but it's that mentoring approach. And I think, that helps you with your critical thinking. And I think too, that sets such a good example for the environment to be like, we're all learning every single day, right? Like when I went to school 20 something years ago, thankfully medicine has evolved. And if I was stuck back in, the early 2000s, that would be an issue because I wouldn't be providing the best level of patient care. And just having that open communication, that mentoring, that we're all involved and it's our patient. I think that's probably been one of the most beneficial things I've seen in hospital environments.
That team approach of really working together
Right.
as a team to take care of this patient, not this is your responsibility, this is my responsibility, but the entire patient care approach here is both of our responsibilities.
Yeah. And if I don't know the answer, that doesn't mean I'm not smart. That doesn't mean that there's something wrong. That just means that hasn't been an experience my life has given me the opportunity to understand. And you know what, I'm going to learn. And so the next time that question comes up, I'm going to own it and share it with somebody else, and that's all okay. Because we can't know everything, we just can't.
Gosh, no, there's been so many times, it happened to me a week ago, 2 weeks ago, where I had a procedure and like it's like you said, you can't get it from the book. So I technically knew how to do this procedure, but I didn't have a lot of experience with it. Don't worry, it was a pretty minor procedure. Like it wasn't anything crazy, but there was a technician working with me who had seen it done multiple times and had assisted with it multiple times. And I had to go to her and I was like, okay, I need you to tell me if this looks like I'm doing this right, because I think I know what to do. I think I know how to do this, but I need you to walk me through it and tell me if there's anything crazy that you normally see that I'm missing. And we work through it together. So it's not just like you said, if you don't know the answer, then you're not smart or you haven't studied enough. Sometimes we don't know the answer and we need you guys, we need our team to help us out and say, no, I've seen that before. This is how Dr. So-and-so does it. Or, yeah, they actually, they asked me this question last time and I learned that we do it this way because of X, Y, and Z. And yeah, so just to put that out there, it is 100% us learning at the same time as well.
That's awesome, Dr. Cassie. And I agree so much with what Carolyn said. And I was just going to say the same thing, that so many technicians, I think probably most, if not all of us, are just such naturally curious people. And so my favorite doctors that I've worked with have been people that love that and embrace that and are constantly showing me things, even if it's something like surgery, something I'm never going to do. Like, teach me everything. I love it. I find it all so interesting. Yesterday, I took my cat for acupuncture, and the whole time I'm like, what does that point to? What does that point to? Like, I just find it all so interesting. So, right, when a doctor can embrace that and really think about the team effort that it takes to take care of the patient. And yes, we all need to know this. It's going to make us all better at our jobs. I think that that's just really powerful.
Yeah. And I want people to know that's when people say a teaching culture or a teaching environment, that's what people are talking about. There's this free exchange of knowledge, and we all love it when people ask us questions, right? Because like you said, we're curious people. So when we learn something, we want to share it, and we want our team to be that way too. So it's just a constant sharing of information, and it really makes the job exciting and fulfilling when everyone's kind of on board and everyone's comfortable. Because sometimes, I've asked really what I would consider silly questions because I don't know the answer. And when you get a response where people are like, that's not silly at all, like I didn't know that either, and this is X, Y, and Z, it really helps solidify a team and makes the job more fulfilling, I think.
Yeah, when you feel like you can ask those silly questions, it's just such a great feeling, like that level of comfort.
Seeing somebody do something different and be like, oh, what have I been missing my whole life? It just that different approach, or like maybe, how they set up a cage differently, or, they did something, even just how they like place their hands and they had to feel comfortable with it. You're just like, I've been missing this. Oh my gosh, that makes it so much easier. And so it doesn't even have to be the silly question. It's just watching how someone else does their good work. You just learn something every day. It's really great when you can be in that kind of environment.
Do you guys have any like specific examples of that? And I know I'm kind of putting you on the spot here, so it's okay if you don't, but do you have any specific examples of something where you're like this light bulb moment where when somebody answered maybe one of these silly questions, or you saw somebody do something differently, how you're like, I am always doing it that way, and it changed things for you going forward?
So this is a very minor story, and I just thought of it because I was unpacking some of my stuff yesterday. Somebody once on our team, found these really long suture scissors, bandage scissors, and they have a really long neck. That's not the name. And a really tiny scissor. And they're great for cats or any little fractious patient where you don't want to be like right by their mouth when you're undoing the bandage. Everyone on the team got them. People were like, this, what is this invention? I don't have to have my fingers near their mouth when I'm, uncutting the bandage of this very, very scared fractious cat. It was amazing. And I tell everyone about it. I show it to people whenever I can. And everyone's just like, oh my gosh, where have these been all my life? And it's just one of those little things, just this little instrument none of us had seen before that, have skyrocketed the sales of them because I've shared it with everyone I've ever met.
That's amazing.
It's sort of similar. Mine's like a combination of things that I use, but thinking about like cats in particular and not having to have your hands over by their mouth, the Calm and Cozy cat wrap, I promise I'm not sponsored by them or anything, but oh my gosh, between that and like Churu, the combination of like Calm and Cozy cat wrap, Feel Away, and Churu, like throw in a little gabapen, I'm like, I can literally get these cats to do almost anything. And it's great. And they're so happy. Change the whole approach there, where, because I tell people that I'm like, if this cat tries to climb my face, I'm going to be no help. Like I'm going to run. So if you're counting on me to save you, don't. So being able to implement that was a big change for me.
I have a friend that uses that and swears by it. Like it's the best thing she's ever used.
Especially doing house calls.
Mm-hmm.
Well, and this one's a super silly one, but like we never used to put anything on our scales. And so if you've ever seen an owner super stressed, it's trying to get their dog up on a scale and have them stay. And the dog is like, I'm out of here. And like, it's this performance thing where they're like, my dog is a great dog, and they usually sit, but when you're looking at it and you're like, I'm sticking them on something that's super slippery and silvery. And they're like, what is happening right now? And usually like it's in a weird corner. And so again, like the introduction of just putting non-slip mats, and it seems like, why didn't I think of that before? But we never used to do that. And it's just like one of those moments where suddenly, again, it's still not their favorite thing in the whole wide universe, but it's not like this horrible slippy thing where they're trying to run away and it's like a bad treadmill. So that was something that was just one of those aha moments where like, wow, that little tiny mat, the owners are happy. The dog is like, okay, this is cool for like 30 seconds. And then you better read it quick and get me out of here. But it was just one of those funny little epiphanies where you're like, why didn't I ever think of that before?
And it makes the whole hospital happy. Like everyone's talking about it.
Yes. Yes.
Yes. And the owners are happy because they're not, have, like you said, that like moment where they're like, I swear they're really good. And you're like, no, trust me, I'm sure that they are. I have no doubt about that. But
Yeah, it's got to be such a weird environment for them.
Right. And nobody likes
Yeah.
to get on a scale. Like, come on. So why put them in that moment? It's just interesting.
Exactly. Well, let's switch gears a little bit here and talk about having clearly defined roles when you come into the hospital. I know that that's something for me that makes it easier. I've done a fair bit of relief work, and every hospital is different as far as what the expectations are for the doctors versus technicians and nurses versus CSRs, how comfortable everybody is with communication. What are your feelings as far as, having clearly defined roles, and how do we create those for people? And Brynn, why don't I hand this one over to you, because I know you do a lot of the teaching and development there. Any thoughts on that?
Yeah, I think you can always start with just a clearly defined role for the day. So whether you have a small team or a large team, I think meeting with your team, with your group, and just kind of going over who's doing what for the day. So it's not this grand defined role of me in the hospital or me in the universe. It's who's doing what today, what do we have on our plate. I used to work in anesthesia and surgery, so sometimes it was, okay, who's going to be the OR tech for today, and just those little things help the day go so much smoother, because you're not constantly questioning who's doing what. You're just sitting down and saying, okay, I'm going to do the CTs today, or I'm going to do outpatient. And then everyone knows. So you know who to go to communicate, you know who the point person is. And even if you have a small team, you're just going to avoid confusion or constant questioning throughout the day. So I think just in terms of a daily schedule, again, taking a couple minutes to define those roles for the day is going to make that day hopefully a little bit more smooth.
I like that too, Brynn.
I love it.
Oh, sorry, Dr. Cassie, go ahead.
No. I was just going to say, no, I love that. I love what you said about, like, you don't have to define your role in the universe, like just for the day, like just for the next 12 hours, who are you going to be and what are you going to do?
And it gives you exposure to different things, right? Like, because some people usually gravitate to one area or another. And so if you don't have something that maybe switches you up a little bit, there's certain skills you might not have time to refine. So if you're always the surgery tech, and you never do anything in the exam rooms, there's a whole nother set of skills, and it might not be your favorite place in the whole wide world, but it's the same thing for somebody who doesn't ever get to see surgeries or see how a recovery goes. So it just really helps in the dynamic of your team, and you find the things you love and you find the things that are not your favorite, but it's that whole empowerment piece, because you get to learn something or be able to speak and be like, you know what, this is new to me. I'm learning this today, but you're still, you have the expectation that that's the role you're going to play for the day, and lean on other people to learn. So I just really like that approach, because it gives you some bounds to go, like, this is where I'm going to focus. Not that you live in a silo, because, if everybody needs help, you need help, but you can just even fine tune some of your skills by switching different departments and not always being in the same part of the hospital.
That's a great point, Carolyn, and a little veering off the topic, but I think as technicians, a lot of times the things we don't like to do are the things we are not as confident in our skill set as.
Right.
Sure.
So exposing ourselves to those things and building those skills is going to decrease some of that not wanting to do certain skills, because I know for me that's true. Usually if I don't like to do something, it's because I feel like I'm not where my skill level needs to be on that procedure or that task.
Totally agree with you, Brynn. I've learned over the years that if there's something I don't like to do, I sort of force myself to do it as much as I can, just so that I can eventually become comfortable doing it. And that's definitely advice that I would give any technician that struggles in certain areas.
Mm-hmm.
And I also love what you said, Carolyn, about leaning on people when you are in those uncomfortable spots. And again, that just goes back to the communication, needing to be open, needing to be positive. And I also wanted to say that if you notice that your practice struggles in this area, if you feel like every day it's just kind of, you go here, or here, you're great at surgery, just stay in surgery. A lot of technicians, I think, can be natural leaders, and you might want to say to your supervisor, hey, do you want me to kind of create a role schedule every day? And sometimes supervisors are really happy to kind of give that away, to give certain things away and to have a little less on their plate. So I would say take initiative if you're noticing that things seem a little unorganized or people are always doing the same things, that you can do that. You don't have to be in a leadership position to be a leader.
No, that's complete is so spot on, Sam. And I think too, all of this sort of leads back to your original question, Dr. Cassie, is like, as a doctor, you're like, I don't know what they know and what they don't know, and if they're comfortable with that. And sometimes you get a chance to demonstrate your skills, and then it builds doctor trust. And they're like, I know she can do that, or I know he can do that. And if you don't have exposure to different team members, you don't always know what their strengths are, the areas where they need to improve. And I just think it all kind of blends back to, that empowerment piece. And, like what you said, Sam, you can be a leader and show like, what, Brynn totally knows how to do this. She's going to be your point person for today. And it helps to build that relationship, but also the trust that I think is so critical in having technicians be empowered, right? Like doctors have to believe we know what we're doing and we've got this under control because it's their patient too. And I think that's just really important.
And it goes full circle here where there's like definitely things that I really don't want to do. And it has everything to do with my confidence level. I think that that's just a human trait to have, of not wanting to do things that you don't feel confident in. There's a reason I try to never open an abdomen if I can avoid it. It's just not my bag. I don't sleep well at night when I do things like that. So yeah, I think that's just a very human way to feel, but you're absolutely right that, it's doing that and building those skills and building that confidence. And then circling a little bit back around, as far as you're saying, like, this is your point person, this person definitely knows how to do that. It made me think back to my relief days of to be able to walk into a hospital and have somebody say, like, this is who you're going to work with. This is like you put it, your point person. They're really good at this. They know this forward and backward. Of course, in a new environment, I'm going to, keep an eye out, just because, like you said, it's my patient too. I want to make sure everything's going the way that I feel comfortable with, but to know who to talk to, who to go to, who my line of communication is going to be with, makes life so much easier. It makes life really good. It makes the day go, even when things get crazy, it makes things go a lot more smoothly.
It's kind of your safety net. If things
Absolutely.
go a little bit sideways, that person is there for you and the team.
Yes, we all need to be there for each other. Sam, I love what you said earlier about being a naturally curious person. I agree. I think that extends to many of us in the field. And so that really opens up the doors to communication when you're asking these questions. Do you have any examples of communication events, communication styles, or anything like that you felt like didn't work for you?
Yeah, I do. I think that we have to be really careful with creating like a negative environment where there's a lot of complaining. Like, yes, our jobs are challenging, and a lot of times there are places where hospitals can improve on communication, scheduling, role assigning, so many areas. But I think it's so easy to just get wrapped up in the negativity that it can create a really toxic environment. So I always try to be positive and hopefully influence people around me. And of course, it's not going to be that way 100% of the time, but I think it's really important. And I also think it's really important to limit gossip and to not gossip at all if possible. I know that for some people that's hard, but I think little things like that will just make such a big impact in the long run.
Yeah, you never know, right? Like your words, you have to make thoughtful choices and what we say and how we communicate, because you never know how it's going to impact somebody, right? And like if this is something that's building on a really awful day, that's something that's outside of work, and when you feel like your work, which so many times is where we spend so much of our day, isn't a safe place or isn't a welcoming place, that can be really hard for people. And especially if you're the one person that is kind of on the outside of the group or might be new to the group or something like that. And I think what you said, just the natural leader and all of those things, staying away from that negativity, because there's so much stuff with all of our patients that can be hard for us to deal with. Having your team not be there to support you and lift you up makes it really, really difficult to deal with even patient situations. So I couldn't agree with you more, Sam.
And I think too, even just, I think sometimes we can use negativity to feel like we're building a team. Like if we're all really frustrated with something, we all get really negative together about it. And it feels good in the moment. It feels like we're relating to each other, that we're all one. But if there's no solution and there's no positive outcome on the other side of that, it's just going to keep breeding negativity. You're not going to get a solution. You're not going to get to a positive point. You're just going to be stuck in it.
Yeah, it's a really quick fix, that feeling of like the camaraderie that comes from that. It's a fleeting moment.
Mm-hmm.
And I know, Carolyn, that we've spoken about this before, also just not emphasizing too much on placing blame, I think is really important.
Exactly, Sam, because I mean, everybody makes mistakes, right? We're human.
Mhm.
And, there's a lot of systems that we might have in place that aren't really conducive to us making good choices, or, that mistakes can happen. And having the person be the object of that blame because something went wrong is not a healthy way to deal with situations, because we could all be that, right? The next day, it could absolutely be us. And if the system isn't looked at and we don't look at things objectively, sometimes it's just an honest to goodness mistake. But, if we don't take a further look into how could we all be better as a team, how could we have maybe caught that mistake before it happened, it can just be a really, again, a negative, toxic place. And then you see those hospitals where you're like, why are we always losing technicians? Why is there so much turnover? Yeah, nobody wants to be unhappy all the time, or surrounded by that kind of thing. Or, if you make a mistake, you are going to be the object of negativity. Like that's not, I don't think any of us, no matter what environment, we want to be at the target of that.
I 100% agree on staying positive, limiting gossip, not placing blame. All of you are spot on. I do want to take a little bit of a devil's advocate approach just for a second and say sometimes that negativity, I think it's important not to deny our emotions. We see stressful cases. We have people yell at us and act completely irrational and demanding for no good reason. When we're, for the most part, they're trying to help and trying to put good out into the world every day. And that can be really tough to deal with. And so hopefully building on what you're saying, is doing that in a constructive way. Like to say, I need a safe space and I need 2 minutes and I just need to get it out, because for me, I process everything in words. Like if it doesn't come out of my mouth, then I haven't dealt with it. And so sometimes I'm like, I'm going to get it out for 2 minutes and then it's going to be over. So I absolutely agree with emphasizing the positivity, but and limiting gossip and all these negative things. But I also think it's important that people have a safe space to say, hey, this really sucked. And I need to get that off my chest for a minute, and then I can move on with my day. But Brynn, kind of echoing what you said, not having a solution, or even if there's not a solution, maybe there's an end point to say, set the timer. And when this timer goes off, I'm not going to yell about this anymore, but at least I'll have felt heard and, had that release for a minute.
Yeah. And I think sometimes we say positive and negative, and positive doesn't mean let's look at the bright side of this really bad situation.
Right.
That's not what we're saying. It's okay to be like, this is a very frustrating, bad situation, but you need to take the road of how do we fix it? I think we need to get those frustrations out, but it needs to be respectful. It needs to be, blameless. It needs a solution. And maybe the team doesn't have a solution, but maybe that conversation is how do we find somebody, how do we find something that leads us to a solution? So I don't want people to think like, oh, think of the positive things of everything. Because sometimes there's not a positive way to look at things, but the goal should be changing it, because you don't want to live in that negative space.
I get what you're saying. Like you need to find a way to completely move on. Like, I'm not going to harbor resentment over this. I'm not going to take it personal. Like it was a bad situation, but I am completely moving on.
Right. And validate that it was something that was not great,
Right.
And I forget where I heard it from, but somebody had made this suggestion to me at one point, like, you physically take a tissue, or, and flush it or throw it away. Like, I'm now done with this and I'm moving on and it doesn't have any more room in my universe and I'm going to move past this. And you can't always do that, of course. Like, I'm not saying everything is just like, a bucket full of tissues, but it's just, but it is like what you said, Brynn, it's one of those things where I have to find something actionable about what happened, because then I feel like I did something and now I can move on from it and I can change. Because if not, it's one of those things that creeps up the next day and then it gets bigger and then bigger and it gets more dramatic and then it becomes heavy. And it's like, sometimes if you give it to somebody in the moment and say, okay, help me work this out, or I really need to address this in a really objective way, then again, it dies that day and you can move on with the solution the next day. Because otherwise, some of that stuff, you're like, we're still talking about it and it's a week later. Like, let's just move past it if we can.
Mm-hmm.
And I think it's important, I've certainly done it, where if you blow up or you vent your frustrations in a very unconstructive way and it was inappropriate or it was too much, you need to apologize.
Yes, absolutely.
I think there's nothing stronger in life. There's nothing stronger in a workplace. There's nothing stronger to help your team than if you made a mistake in how you chose to vent your frustrations. You need to own up to it to your team.
100%.
That's an amazing way to set the example and just help create the culture that you want your hospital to have. I love that so much.
Absolutely. I'm sitting here going, all right, how much time do we have? Because now we can get into like labeling emotions and, all these different things, but that's probably beyond the scope of what we're doing here. And kind of thinking along those lines, this has been such a cool discussion. I'm so happy to have all of you. And I really hope we can do it again sometime. Let me wrap up by asking each of you, what advice, after, your years and your experience in the field, what advice would you give the you who originally started in this career? Carolyn, do you want to start us off?
Sure. I think probably it would be to be brave with my words, to ask the questions at the start instead of feeling like I was less than because I was uncomfortable. I was afraid to ask the question, and realize my voice matters right from the beginning. And that really setting that dynamic as part of the first interview, I think, is so important, because I was just grateful for the interview versus realizing that I'm interviewing the place that I'm going to be spending the majority of my time in, and really being thoughtful in those questions and really having a vision for what I want for my career and really going for it. And I think I was nervous at the very beginning of my career, and I got my feet and I had a great environment to be able to do that. But I think that would be what I would tell myself is like, if this is where your heart lays, like, go for it. And, really just ask the questions and be that person who wants it. And if it's not the right environment for you, find the right environment for you to be able to grow in the best way that you can.
I feel like I want to write that down and keep that advice for present me. What do you think, Sam? Any thoughts on what you would tell the original you that started in veterinary medicine?
Sure. I would say ask all the questions. Don't be embarrassed. Don't be ashamed. Just ask so many questions, and definitely look for a place that makes you happy. It may not be what you originally thought would be your niche, but there are so many niches in the field. So just explore, find something that you love and that you're really passionate about, because I think sometimes we don't do that. And then it's like putting a round peg in a square hole, or the other way around. But you know what I mean? Like, it just doesn't fit. So that, I think, is really important. And I also would say, make sure that you're connecting with other technicians. Like, I know it's really easy to get CE online, but I would say at least 2 or 3 hours a year, do something in person. Like, of course, I love conferences. I always have. That's been a big part of how I connect since I was in tech school. But like, go out, go to the conferences, go to the lunch and learns, and like meet people and talk to them, because I have found it so inspiring throughout my 10 years in the field.
Also good advice for present me. Thank you guys for all of this.
I would say I wish I had been better at communicating my personal needs at the workplace. So I was lucky enough to be in an environment where I was able to push my skills. I was able to ask questions. I was able to try new stuff all the time. So that was very fulfilling. But looking back, I realized that I took a lot of myself out of that. I didn't recognize when I needed a break. I would skip my breaks because I'm a hard worker. I can do all this. I want to keep going. I don't want to miss this case. And now knowing you probably should have just taken your 10-minute breaks, that really would have helped some of the negativity you were holding in your head and some of the frustrations you had. That would have helped me a lot. And it was, little things, but I definitely was that person that wanted to push through all my breaks, and I didn't need a break. And looking back, I'm like, you always need a break. If you have the opportunity to take a break, take a break. And I wish I could have been that person for other people too, because I think I worked on a team we were all very we're just going to push through, we can do this. We're hard workers. And I wish for all of us that we could have been that team to be like, you want to go take a break? I've got you, 10 minutes, 5 minutes, go, take a walk, get some water, go to the bathroom. So I wish that was more apparent. When you're younger and you're excited about stuff, it's very easy to think it's not important.
Brynn, just to expand on what you're saying a little bit, if this relates, I would say it's also a lot harder to advocate for yourself on the back end than it is to draw those boundaries up front. Because when you do push through continuously and you skip your breaks or you skip your lunch, it can become an expectation, and not necessarily because there's anything wrong with the person who has that expectation of you, that we personally have set that expectation of ourselves to say, well, this is just how we do things. And so remembering to set those boundaries on the front end, you're still a hard worker. You still can push through when the situation calls for it, but it doesn't need to be like that day in and day out.
Exactly.
And you're better for your patient when you take the break. If you can't even think of it for yourself, which you should, you're more focused, because at the end of really long shifts, are you really dialed into your patient? So it's just full circle. You really need it for everything you do.
Yeah, and there's unfortunately so much attrition in the field. So many vet techs only do it for a few years. And I think that if we could kind of let our baby vet techs know right from the start, this is okay, it would really be immensely helpful.
Communication, culture, sustainability. I love all of these words. Well, guys, this has been an awesome discussion. I really appreciate all of you joining me. I've truly, truly enjoyed it. And yeah, I hope we can do it again soon.
Thank you.
Yeah, thank you. It's been great.
Thank you so much, Dr. Cassie.
Thank you so much to Sam, Carolyn, Brynn. It was so wonderful talking to all of you. For more episodes like this, click on the Education tab on the VetFolio website. As always, we'd love to hear your input on this talk, as well as ideas for what you'd like to hear in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassie DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.